Good afternoon, ladies and gentlemen. Before we start our presentation for today, I'd like to ask you a question. In 2020, would you buy a car without an AC? We will leave the answer of this question till the end of the presentation. I'm Dr. Salam Abu Arqub from Smile Engineers Dental Center, Senior Resident of Conservative Dentistry at Jordanian Royal Medical Services, and I'm here today to talk about the complexities that might face the dentist when he's using magnification, especially microscopes, and how Leica microscope overcome those complexities. I have been using the microscope for 3 years, starting from Leica M525, and now I'm using M525 for more than 1 year. Throughout this presentation, we will cover these 3 points, and I will start with introduction and the uses of microdentistry of microscope in Smile Engineers Dental Center. So, the microdentistry is utilizing enhanced magnification and illumination to maximize the maintenance and the preservation of soft and hard oral tissues and tooth structure and preserve it with minimal invasive procedure. Moving to the uses, is it only for endodontics? To answer that question, let's see this video. This is our Leica M525, our hero for today. And for the uses, we can use the microscope for every dental procedure, starting from endodontics, from access cavity, till we reach the obturation, especially because we are dealing with very small canals. Also, we can use it not only for endodontics, we can use it for caries removal and cavity preparation, before access cavity, and for pre-endo buildup. Also, we can use the microscope for deep margin elevations and even for simple caries removal procedures. We can use it for crown lengthening or margin exposure or gingivectomy, for scaling and polishing, and for removal of stains with sandblasting. Also for preparation of crowns, veneers, and finishing of it, and we can use it for immediate dentine sealing and the placement of the restorations. For retraction cord placement, even for the anesthesia, for margin checking before cementation, for post removals, for flaps, extractions, any kind of surgery that require bone removal or periapical surgeries. For temporization and isolation of gingiva before bleaching, for discuss the patient the problem that he have, like cracks, or even for documentation. Simply, we can use the microscope for any kind of treatment done under the dental chair. Now let's talk about the main idea. These are the complexities that might face the dentist, and we will start with patient preparation. Usually, set up the microscope and starting moving it from zero position until working position, it takes a lot of time. But in Leica M525, we can see here clearly the required time for patient preparation, starting from customizing the eye pieces until we reach the zooming and focus on when do you want to see. And it's only take only 20 seconds. The other problem is limitation of movement of microscope, especially at the beginning of the treatment. Why? Because we need our hands to move the microscope, and at the same time we need to handle and catch our instruments. So, like a microscope, give you the ability to move the microscope only using your eyes. So you can use your hands for any handling for tools. The second complexities that might have the dentist is the ergonomics. Starting from, usually the microscope have a large size and space occupation is too large, in addition to small field of view. With Leica microscope, it have a small size microscope with large field of view. And for the accessibility, we cannot reach all areas of mouth easily due to lack of flexibility and movement of microscope in all directions. But here in Leica M525, we can see how flexible is it, and we can use it in all directions without any difficulties. So we can reach any point we want to see inside the mouth easily, and the accessibility is not a complex thing anymore. And every time you need to move, or the microscope moves, you need to reposition the microscope. You need to reposition the microscope. But in Leica M525 uses these two buttons and only one wheel. You can balance and customize your microscope so you can easily go back to your zero position with every move without any effort. And for the placement of focus and zooming wheel in the center of the microscope, and you face this problem if you use one hand, but in Leica microscope, they place them on the left and on the right, so you can use the hand you use or both of your hands to adjust the focus and zoom the way you want. The third complexity is intensity of light. If the intensity of light is too low, you will lose your time and attention and control, and you will get more stressful procedure, and that will lead to affect your prognosis. And if you have an option to increase the intensity of light, you will face two problems. The first one is the reflection, and the second one is the heat generation. And how Leica microscope overcome this problem? Simply, when you increase the intensity of light, it increased in a way that it's not harm your eyes. So we can see that the light increased outside, but inside the mouth it's good and not harm for your eyes. And for the heat generation and patient discomfort, the question is, why does these lights may lead to heat generation? At first, when you are working at low magnification, the field of illumination fills the field of view. But when the magnification increased, the field of view becomes smaller, but the illumination field remains the same. So this incremental will make the illumination outside field of view could potentially cause burns. And Leica M525 with auto iris automatically works with the zoom, so decreasing the illumination field as the field of view decreased. So no any peripheral illumination outside the field of view, so no tissue burns. And the other cause for the heat generation, that's usually when we are working in long distance, we are working in the green area, and it's very safe area to work. But when we're reaching and working under decreased working distance, we are working on the red areas, and it's harmful, and maybe it will lead to heat generation and burn of the tissue. But with Leica Bright Care, the auto adjustment for safer illumination, and you will be always working on the green area. So no heat generation, no tissue burns, safe for you and safe for your patient. The fourth complexity is the zooming. Usually the microscope has fixed zooming ranges, especially when you are moving from one X to another. And this interrupted transition between the zooming make you lose of focus and attention and control. So you will lose the time and you will lose the attention, and that will be, at the end, affect your prognosis. But with it's coming to Leica M525, you can see easily how you can zoom in continuously without an interruption, so you can focus in and out easily without any difficulties. And beside these two buttons, you can see another two buttons for focus. And it's the fifth complexities that Leica offer a solution for, and it's the loss of focus. We lose of focus because we are working with high magnification and a small field of view. So that will lead to distraction with every move and loss of time. But in Leica microscope, because you have a large field of view, you can zoom and focus easily. And here in this video, I choose to focus on the beard of the patient to show you how you can focus on every single hair you want to see. And with all these complexities, we shouldn't forget to mention the resolution. If you had a very bad resolution, you will not be able to see what you want to see. And that will lead to loss of your time and attention, and loss your control, and that will make the treatment very stressful, and that will affect your prognosis, in addition to fatigue to your body and your eyes. But in Leica microscope, you can see how the resolution is. This video is taken under Leica M525 without any editing, and you can easily see the resolution or the sharpness of the picture. And if you see this scene under Leica microscope, you will see how sharp the image is, and you will not feel any strain or fatigue to your eyes or to your body. All this previous complexity will lead to fatigue and strain to your body and your eyes. Also, it will make it very hard to learn and very hard to use. On the other hand, with the Leica microscope that's come with these features and facilities, make it very simple to use and to learn, and it will let you give you the patient the best treatment without feeling any strain or fatigue. Now let's move into the third part of our presentation today. And before talking about the values that Leica added to us, let's see this video and why we in Smile Engineers we did choose Leica microscope. Simply because we are looking for the best for us and for our patient. And if you are looking for the microscope that give you the best facilities and technologies with the best competitive price, with ergonomics, Leica microscope is the only option you use. And about the values, if you are working in this place with that ergonomics and the best illumination and magnification and resolution, you will give the patient the best treatment. And that will make the treatment very enjoyable experience. And that's lead to efficiency and accuracy of the treatment, especially when you are discussing the treatment plan with your patient. And in this video, we can see the difference when we discuss the treatment plan using only the mirror and do the same thing and discussing the treatment, the same treatment with the with the patient when he or she seeing under the microscope. Usually, patient will accept and understand the treatment plan and accept it when they seeing it under the microscope. And that will lead to patient satisfaction. And having a satisfied patient, that will play an important role in your marketing of your place. And in these upcoming videos, we can see the difference between when we are working with or without the microscope. In this video, we can see how the patient companion will always ask questions and want to see what are you doing. And you can easily see how it's different when you are working under the microscope. You can see him just sit and see what you are doing. Also, you can easily see how your patients will help you in marketing your center by capturing what you are doing, what you are going to do, and your treatment, instead of sitting and playing with his mobile. All these facilities and values will enhance our credibility, and this appears clearly on our patients' reviews on social medias. And you can see easily how they mention the techniques and technologies that we have and equipments we have in Smile Engineers. So, in addition to all of that, we add a new way of documentation beside the X-rays, so we can take picture and pictures and videos and give it to the patient for the treatment or the treatment plan. All these values will make us a leading center in areas, and that of course will increase our income. And through this video we can see how the patient different when they treated using microscope or without.
Because this is your patient. We know.
Now, let's go back for the first question. Before 20 years, buying a car without an AC, it was an option. But now, in 2020, it's not an option anymore. Every car you want to buy, it comes with air conditioning. And when we are coming to the microscopes, now it's an option. And in the near future, it will become the standard. So you can be a leader now and follow the dental world by being a micro, minimal, digital, and be a leader now and see the future under Leica microscope lenses. So ladies and gentlemen, at the end, would you buy a car? Thank you.